You didn't see this article by the world-renowned scientist, Dr. Russell Blaylock. Here's a couple of quotes from a brilliant article. Blaylock, face masks pose serious risk to the healthy. Listen to this. As for the scientific support for the use of face masks, a recent careful examination of the literature, in which 17 of the best studies were analyzed, concluded that none of the studies established a conclusive relationship between mask, respirator use, and protection against influenza infection. Several studies have indeed found significant problems, however, with wearing such a mask. This can vary from headaches to increased airway resistance, carbon dioxide accumulation, to hypoxia, all the way to serious life-threatening complications. While most agree that the N95 mask can cause significant hypoxia and hypercapnia, another study of surgical masks found significant reductions in blood oxygen as well. In this study, researchers examined the blood oxygen levels in 53 surgeons using an oximeter. They measured blood oxygenation before surgery as well as at the end of surgeries. The researchers found that the mask reduced the blood oxygen levels significantly. The longer the duration of wearing the mask, the greater the fall in blood oxygen levels. And lastly, studies have shown that hypoxia can inhibit the type of main immune cells used to fight viral infections called the CD4 T lymphocyte cells. This sets the stage for contracting any infection, including COVID-19, and making the consequences of that infection much graver. In essence, your mask may very well put you at an increased risk of infections, and if so, having a much worse outcome. There's actually one more. When a person is infected with a respiratory virus, they will expel some of the virus with each breath. If they are wearing a mask, especially an N95 mask or other tightly fitting mask, it will be constantly rebreathing the viruses, raising the concentration of the virus in the lungs and the nasal passages. By wearing a mask, the exhaled viruses will not be able to escape and will concentrate in the nasal passages, enter the olfactory nerves, and travel into the brain. See, that's the eye of intelligence. These are the eyes that can read, and Matthew, you should be using your eyes.